Hi, I'm David from Pharmacist 777. What really concerns me is how people out there who have sleep apnea don't realise how a poor night's sleep can really devastate your health. Previously we spoke about sleep apnea and how you have the blockage of the windpipe and how we discussed that it results in low oxygen levels. So continuing on from there, low oxygen levels, if you think about if you have a child who's choking on a lolly, so the lolly is stuck in the throat and the child can't breathe, so they start to panic, everybody around them starts to panic. The child then goes, or the child's body then goes into a fright or flight response. So fright or flight means that there's an increase in the heart rate as the oxygen levels go down. Continuing on from there, that there's an increase in blood pressure. And while all this is happening, again in the fright or flight response, is that adrenaline is released. What the body then does is that the body then increases the release of glucose because it thinks that it needs glucose to be able to respond to this panic. So as the lolly becomes dislodged and then the body starts to relax again, and then 30 seconds, a minute later, then the lolly is stuck in the throat again. So all this continues happening. So people who have moderate to severe sleep apnea, so this blockage is happening 200 to 300 times every night. The long-term consequences of this is that the cardiovascular risk or disease increases by 200 to 400% due to the increase in the blood pressure, the increase in the heart rate, and increase in the adrenaline as well. From there, there's also a link between the increase in the glucose levels and also with type 2 diabetes. Mental issues will also become an issue, so mental health, such as mood disorders, depression, and then as it leads to a decrease in physical activity, diet then becomes an issue where people are getting more takeaway because they just don't have the energy to do anything. Then they start to put on more weight, and then obesity becomes a factor. And then linking all these together is that as you put on more weight, it then makes the sleep apnea worse, and then the oxygen levels go down, and it's a vicious cycle. So our message today is that it is serious, it does have long-term consequences. So if you know anybody who snores or that you believe has sleep apnea who stops breathing at night, then come to any of our pharmacies to get tested. If you need any further information, go to our Pharmacist 777 website or any of our Pharmacist 777 stores.